Thank you very much for joining us in this session. I have the proud task of moderating on behalf of Jan Andre. We just finished a great session a few minutes ago, and we have really enjoyed that. I'll start this session off by saying that personalized healthcare has brought a new focus on patient centricity and also knowing your patients well. The pandemic has revealed that half the problem that we had was that health systems were not prepared for the pandemic. The other half was that many health systems did not know their patients well enough to provide them with timely, clinical, effective, appropriate information, healthcare, and social services and care across the whole healthcare spectrum. We're seeing this still going on. And now there is a flurry of research going on. Let's know our patients very well. Where are they? Where are they sitting? What are their underlying conditions? Do they own a mobile phone? How can we test and trace them? And all that's going on. So this afternoon session is very easy for me. I don't need to emphasize how important it is. So I will introduce the two panelists. Jan Geisler, as you know, has always been one of major patient advocate out there, and he has really helped global patient movement. He's so approachable, and I think all the people in low and middle income countries appreciate that, and I think we in IAPA appreciate his support and that open door policy, and very knowledgeable and I think respected by both the patients community, health professionals, and health policy makers. So Jan, welcome. And on the other side, I've got Andre Trottier, who's from the Roche team. And Andre has really helped me along in understanding personalized healthcare. I think we have been sitting along and discussing this for a long time. There is a patient health council as well, where Andre helps and comes and advises us on this and on personalized healthcare. And I think we really appreciate your insight and help and approach. So I will start by asking Jan to start the whole groundworks, lay out what personalized healthcare means, how you will set it up, and then I will ask Andre to come in and wrap up with the insights that you have over these years. I think you've invested so much of your personal time in this and have a very deep insight into how it will unfold. Thank you, Jan, over to you.
I think, Andre, you're starting, isn't it?
Oh, sorry, Andre, sorry.
Yeah, no, that's totally fine. Okay. Kowaldev, thank you very, very much for this kind introduction. I'm just in the process of sharing my screen now. I hope that you can see this. Yes, correct. Excellent. So thanks again. This is a very impressive conference. I've been tuning in all day. Some really, really good speakers, great insights. So it's a real honor for me to be here with you today. Thanks for having me. I'd like you to pause, everyone to pause for just a moment and just take in the full impact of COVID-19. We're close to 1 million people that have died worldwide. 30 million people are infected or have been infected. We've heard all day there's major disruptions to patient care all around the world. We're just beginning to understand the long-term financial impact of all this, right? And we've heard how the inequities have just only increased, in fact. It's affecting every single one of us. It's very personal, right? And actions are needed to tackle this global challenge. And those actions are actually shaping the future of healthcare. So similar to what we need to do in COVID, right? We need better, earlier diagnosis. We need more tailored, targeted interventions. We need to exchange data so that the services are more responsive and integrated. And COVID is actually triggering some of these changes in healthcare. And that's particularly true when it comes to digital health, for example. So we set out to capture these policy changes that are occurring now all around the world. And we actually found hundreds of distinct policy changes that have been made that are supportive of a transformation of healthcare system. Our conclusions are quite clear, right? The pandemic has obviously reinforced and accelerated the digitalization of healthcare systems everywhere. So the most eclectic example I have of that is that of Greece, where the government actually banned the use of fax machines. So that sounds really strange idea, but it's actually forcing in some way the health system to go digital. We've seen progressive data and digital health policies adopted really, really quickly. We saw, for example, in Germany, where there were difficulties in sharing of data between the states within Germany, within the system itself, and some really quick and very foresight changes were made to the regulation to allow that to happen. So some pretty fundamental changes have been made. I'm really happy to be speaking to a group of very savvy advocates from around the world. And so you obviously get this. We need to get these policies right. What's being deployed today need to continue. It needs to accelerate, and it needs to be sustainable, right? It needs to not be seen as an emergency measure, but actually a solid change. Over the next two slides, I'm going to give you concrete examples of some of these policy changes that I've referred to here. The first set of policy changes is around the idea of policies that enable access and a greater sharing of healthcare data, which leads to improved decision making. So in China, for example, in the municipality of Hangzhou, which is close to Wuhan, they quickly started to integrate both traditional data sources, lab tests and so on, with non-traditional sources, so electronic health records, even social media reports, and starting to combine all kinds of information to make better decisions on what needed to be done. In the UK, the UK Minister of Health and the NHS England went sort of the legal route. They gave legal direction to the NHS digital group to have better regulation, better guidance on how data can be collected and analyzed so that there's a better response. In the country of Canada and the province of Ontario, their diverse sets of data have been integrated. So the government invested in a platform called Panther that is able to link data from multiple sources. And then on top, they've added an AI and machine learning algorithm to it to really help the health system plan and respond more quickly. So all these examples are meant to solve the immediate issue in front of us, COVID-19. But when you look at what those policies are, they actually are policies that will serve us well in the future. The second example that you've all experienced is around digital health and remote patient monitoring, right? So overnight, it's been difficult to have telemedicine sort of implemented. It's been spotty everywhere, and overnight, billing codes are being set up, reimbursement services are there, consultations are made, and those changes were made. So some people say it's 10 years of policy change in a matter of months, right? And those are likely going to stay, I think, by the demand. My patients, I think, are understanding this is actually possible, and the remote care concept is certainly gaining ground. all of this is important because, you know, in the end, these policies are about really having an impact on every step of the patient journey. So if you start with diagnosis, early, we've seen the importance of diagnosis, but early and personalized diagnosis, right, with new advanced technology will provide more information for patient, which will trigger then a more personalized care plan. That leads to more rapid access to personalized therapy because the diagnosis is clear, the personalized care plan is clear, and it goes a lot faster. There's also, you know, an important part that's gaining ground around remote patient monitoring, right? So seeing what happens after, what happens during treatment, what happens a little bit after, right? So there's all kinds of tools that are available today around wearables, and many, many more are being developed. But at the center of it all is data and insights. And it's a really reinforcing circle here. The data that you get actually comes back into the system and provides additional information. So not only is it good for the patient that's being treated, it's also informing patients of the future. And this creates a whole learning system. So the benefits are quite clear for a patient. You know, you actually get more data on your disease. You feel much more comfortable that the treatment that is offered to you is targeted to what you need. You have much quicker access to what you need. The benefits are greater because it's more certainty. And in the case of cancer, for example, there's an earlier detection of disease recurrence. In other disease area, you're actually tracking progress and outcomes. So the bottom line here is basically COVID, as devastating as it is, you know, has actually provided a ground for health system transformation. And those policies that are being put in place are setting us up well for the future. The trick is to make sure that that continues. And, you know, patients certainly play an absolute critical role in this transformation. And so I'm eager to hear what Jan has to say about that perspective. And Jan, I'll turn it over to you. And I think that's the process, right? We go to you, and then at the end we'll do Q&A, correct? So over to you, Jan.
Thank you so much, Andre, and thank you for, let's say, setting the frame so well for personalized healthcare, because we have such a wide thing to bridge between personalized healthcare, how is COVID changing our minds and our processes, to how do we lead to the future of medicine. So I'm trying to take it forward from there, and while I'm trying to share my screen, I hope that works. Yeah, should be working now. I actually want to talk a bit about a very difficult bridge as well, but let me just take one point which you said, Andre. If COVID managed us to get rid of fax machines, I mean, there was something really good happening with COVID, because this is really, if we're talking about digital, we can't believe that's still there. No, but talking about experience, and I mean, I'm a leukemia patient now for 19 years, and I've been diagnosed at the age of 28, at the time when Facebook and Google wasn't there, and the world is very different. But from the beginning in CML, we've been looking at personalized medicine and target treatments and monitoring and so on. And being still a patient now, we've chronified this cancer. There are huge challenges, there are benefits of personalized medicine, but also now in the COVID times, we see there are a lot of challenges. So I'm trying to bridge that between the experience we had as a CML community, the way we deal with it in COVID times as patient advocates, and what does it mean to the supermodel business, because there are quite a couple of comparable points around that. So just taking one step back, saying what is important for patients if we talk about personalized medicine. Of course, we want to have new therapeutic approaches, because still cancer and all kinds of severe diseases are far from where we all want to be. So what patients want is timely diagnosis, the right treatment for the right patient at the right time, avoiding over-treatment, which we see in cancer a lot, under-treatment, which we see a lot, and ineffective treatment we see a lot, and of course, well-tolerable curative therapies for every patient in need. And we know that personalized healthcare is getting there, because healthcare has been personalized for the last 2,000 years, but what changes is our understanding of biology, of mechanisms, and then actually find the unique characteristics and treat every patient exactly with what they need, avoiding all these different things which I've mentioned. And probably one thing that is often not so much regarded is that patient preferences are different. So one patient might, with exactly the same disease at the same stage, with the same treatment, might expect something very different, depending on how they live and what they expect from life. So current therapeutic and diagnostic computational advances in personalized healthcare actually allow us to do that. And CML, chronic myeloid leukemia, is something where we've pioneered a lot of things, because molecular testing has been with us all the way. So we've been tested for a specific mutation also, and that basically gave us the diagnosis. But then when something went wrong, when responses didn't come, we used sequencing actually to guide second-line therapy. So depending on the mutation, we got therapy A, therapy B, therapy C. And the good thing today is that we have the choice of a number of therapies. And then again, we discovered the concept of, after years of exhausting cancer, you can actually stop treatment in about 25% of patients. So again, patients go in the testing loop, and we're trying to give those that actually are right by biology to do that, they can actually stop treatment safely. And that's what I did after 13 years of treatment. I actually was able to stop 5 years ago, but I'm still under monitoring every 8 weeks. And that's a different concept than many cancers as well. What we're working on as a community at the moment is to find out how will genomics actually give the way that I don't need to do monitoring every 8 weeks. So how can we actually go from chronification to cure? And that's what we hope, of course, that all the 200 cancers, all the rare diseases will get there at some point in time. So looking at our advocacy world, we know that we need to work with evidence, because very often we have opinions, but without just with opinions, you can't change policy. And that's why also now in COVID times, we see the calls everywhere that we need to collect evidence around the transformational change. Otherwise, we're going back to fax machines after COVID again. We, of course, need to tell, this is really making a difference for patients. This is really transforming medicine. This is how we better deliver what patients expect. And that's the way we increasingly work as advocates. So where's the bridge to COVID? The bridge to COVID is that the work group of European cancer patient advocacy groups, which encompasses 23 patient umbrellas in Europe in different cancers, actually said, so what's the issue about COVID? And of course, everybody had an idea and had experience and had patients that turned up in their online groups, in their hotlines, and so on, and said different things. So we built evidence around that. So we made a survey of the 23 umbrellas and asked the leaders, so what are the issues around psychosocial issues of COVID, around the patient management challenges on cancer that we have, around the research challenges, and also what's the impact on the institutional level of patient organizations, so can you still operate? And here are some of the things that we've received. And you can see the whole map on the internet, because there are many, many more factors, but I'm highlighting some of them. I mean, virtual consultations. How long have we said as cancer patients that we don't want to queue up for 2 hours in the clinic to have a 10-minute visit or appointment with a physician and have a blood draw? Now suddenly it's possible, because there's pressure in the system. People don't want to go because of COVID, and they're delaying their cancer diagnostics and their tests and their follow-up, or even getting diagnosed properly, so patients are turning up late. And suddenly virtual consultations, which we've been asking forever, and it's always been said we can't do that, suddenly you can do it. We just need to make sure that we're not returning back to fax machines and say, now you queue up again, guys, COVID is over. Then regulatory design, suddenly you can change trial protocols. You can do blood draws with a GP and send it to the lab that is in the clinical study, because you just need to do a blood draw instead of having patients go to the clinical center just for that. Will this stay? Will that kind of flexible design of trials that we actually at the moment see, and where the regulators are more willing to give in and to allow a redesign. Will that stay after COVID? We do hope that. We see it's there at the moment. But of course, one of the, and of course, digital skills are important. I mean, we've always said we need to meet face-to-face. We can't do brainstorming, and suddenly we discover a lot of these things where I've been spending hours and hours on Lufthansa can be done in a virtual meeting with Group Map or Miro or whatever as a supportive tool. So we're learning, we have a steep learning curve as patient organizations, and as we've done a virtual meeting knowledge center to actually train up our patient organizations about that. But what concerns us are the inequalities, the new inequalities. Patients that have not been vulnerable are now becoming vulnerable due to financial inequalities, access inequalities, and also age inequalities, because probably some patient populations cannot deal with the digital tools. So are they left behind, or will it increase the inequalities between rich countries and like Germany and countries which are now using cost cutting to afford COVID, but the resources will never come back to that place. So we need to deal with that. And that's why I'm using that kind of supermodel medicine comparison. What we need to be careful about, that we're not increasing inequalities through personalized healthcare, that patients actually, and testing and so on is not only the next step towards personalized medicine, but might also be a supermodels medicine. It's lovely to look at very costly, accessible only to a few, and of no real value to many. We need to use COVID also in the transformational change we see to think about how do we make it accessible for everyone. And nothing is better to discuss that is the inequality we're going to see about vaccination in COVID, because we don't know yet how we're actually vaccinating the whole world population against that. So that's going to be very interesting. And I think we're, as patient groups, the watchdogs to make sure we're not creating supermodel medicine, but really personalized, targeted healthcare for everyone. And I think that's what IAPO and many other organizations and we can and so on strive for. So what do we need to make personalized healthcare happen? We need to learn from where personalized medicine already works. And I mean, the seminal community has been around here, and luckily our survival is good today, while it has been deadly for half of us 20 years ago. So we can share and help. How can we need to make all stakeholders collaborate, and there have been a lot of sensitivities about all stakeholders collaborating. The regulators can't do it alone, patients can't do it, pharma can't do it, payers can't do it. We all need to get together. We need to make the policy change happen. Let's use that kind of transformational change of COVID and make use of that the transformation to digital health, flexibility and research design really happens and stays. And I think this is what Andre was also calling for. Let's make use of that change. We need to, of course, overcome institutional resilience, because a lot of people are saying that's how we've always done it, and we're not going to do it differently. And also the issue about inequalities, which worry me a lot in these days, and even more in COVID times. And of course, I mean, this whole Congress is in the end about patient engagement and co-creation. And let's go away from tick boxes and really have patients in those processes, make them co-create the transformation and also the systems that will emerge afterwards. And let's make evidence-based advocacy the norm for us. That's our homework, because we need to bring the evidence from our patient community as well to make sure that regulators, policymakers, payers, and everyone can make good decisions based on real evidence. Thank you so much. That's my plea. And now handing back to Kavaldeep.
Well, thank you very much, Jan. That's very nice. And I think you put across, I think between you two, you've covered most of the essence, I think, of the whole personalized health landscape. Just to start off from where you left off, Jan, and I think no particular order we can answer this. I've got a question here posed to me on my SMS, so my WhatsApp at the moment. Somebody's not coming forward, but I think it's a very important question. Do you think we would like to see a WHO guidelines or something similar researched and published now on personalized healthcare? Because this particular area of healthcare is advancing so fast. The only global technical body and whose remit is precisely this is the WHO. Do you think that can work, Jan? And then I'll ask Andre.
Well, I think I'm a strong believer, and I know it's very controversial these days in WHO, because they have the full breadth of things in mind and not just think about the rich states and poor states, they think holistically. And I think guidance and support in making that happen is very much needed. And if we think about the comparison with Supermodel Medicine, again, access is such an issue. The more we invest into personalized medicine, the more access of privileged groups against those that can't access will be the case. And I think WHO can help a lot. And I think probably except one country in the world, people listen to WHO. And that's why I think it's really, really important. And I mean, you with the IAPO, I would like to actually bounce it back to you, what you think, Kavadip. I mean, IAPO has always been pioneering, let's say, the global perspective on things, and which with global, I do not only mean transcontinental, US and Europe, but really global. And that's why I would be interested in your perspective on that. I personally think support from WHO can only be helpful.
Thank you. I'll answer. I'll put to Andre. Andre, what's your opinion on this? I'll answer.
Yeah, that's a very good question. And I mean, I think WHO can play a critical role here. I mean, and already is, right? So if you look at the ambition of 1 billion people under universal health coverage, right? That begins to get you to where you need to be. And, you know, we look at health system transformation. How do you get there, right? Obviously, that is at play, and I think that's a laudable goal, and I think it's really consistent with what we're trying to achieve. So a lot is already being done. The other thing that I'll point to is the WHO has developed a global action plan on digital health. And it's taking a lot of the themes that we have discussed today and actually spells out how that leads to more personalization of care, right? So the link, I think the guidance is already in place. So there's a lot of support from WHO towards that goal. In addition, I think WHO plays a really important convener role, right? They're able to bring you know, the health systems and many partners around the world together. And so their influence is great in that front. So I think, you know, as Jan said earlier, we need everyone sort of at the table if we want to make strong advances. And that's a little bit what's happened with the pandemic. You know, a lot of barriers between stakeholders were removed. You know, we really need solidarity right now, and people have strongly come together. And so let's keep that going. What do you, Kawada?
Thank you. Yes, I think, Jan, you're absolutely right. I'll answer your question on that. Yes, we would like to bring this WHO perspective into it. And as Andrew said, it's quite important to bring that digital healthcare policy framework that they've produced in their guidelines. The second question, I think, is from UHC that you brought up here, 2030. Should we revisit it and maybe include within it a provision to provide good Wi-Fi and broadband to every member state, or maybe something similar to what's happening now with vaccination? Should telecom companies get together or other communication infrastructure companies, and in the name of health and control of future pandemics, should we provide these people, ministries and countries, with free Wi-Fi and broadband of high quality for this? It's almost using, to have personalized healthcare, we do need a pipeline and we do need a good broadband. What's your opinion on this? Especially under, as you know, the industry is in very good repute now. You are loved by everybody because you've come to our rescue with, I think, with Roche and the testing equipment and others. So what do you think?
I'm loving the question. Just the question itself, you know, is making the link between digitalization and health, right? And so I think that's exactly in the right direction. So we need to keep asking that question in areas where there's no service, because that will be in the future a contributor. A lot of people refer to this term, leapfrogging, right? And this idea of, some countries having gone from, really little communication to having a phone, right? Sort of a smartphone, and be able to get a lot more information that way. So, I mean, that's an example of a step in the right direction. You can see the impact. WHO is running a really good program with ITC, with the International Telecommunications Agency, that collaboration is exactly in line with the spirit of that question, right? So that we need to bring technology together to the service of health.
Thank you. Jan, from your side, how do you see that?
Well, I'm just thinking about how do we get Wi-Fi into fax machines. No kidding. I mean, I wouldn't focus on a specific technology like Wi-Fi. There's companies that shoot up 15,000 satellites in the air to actually serve the underserved, which I hope will become, let's say, the move towards internet access as a basic right for everyone, because I think you can only get that informational gap bridged if everyone has access to internet. And I totally agreed. Our experience in low middle income countries is that in some countries people don't have PCs, and probably nobody has where they live, but there are mobile phones. So how do you actually deal with that, and how do you make sure information becomes accessible? Of course, that plays into so many things. How can they get the results if they need to travel for 3 days actually to get the blood draw, to make sure it reaches them how they are doing and so on. So I totally agree. There needs to be a lot of investment in there. I don't fix it on a specific technology, but I fix it on internet access as a basic right. And for having empowered patients, you need to be connected, or need to have the possibility to have all information at hand, and also be empowered to be a manager of your own condition. And that's, I think, needs to be everywhere. But I think that's what we're all striving for at the moment.
Thank you very much, Andre and Jan. I think this is a very interesting session. I think it's really brought us. Unfortunately, we would like to continue, but it's just that time. But please, everybody, follow both Jan and Andre on the social media and elsewhere. We continue this debate on personalized healthcare, and I think it's very important to do that. Now I will ask the audience to join us after the mobility break in a very interesting follow-on from this. We are trying to launch a study to look at mapping the patient journey for NCDs, and can we understand them better? Can we understand everything that we know of, and hopefully serve them better? As we started the system, health systems didn't know us, in the sense that they suddenly found out they have actually got patients out there to deal with, but they were unaware who these patients were. Suddenly we had faces, and we had names, and we had needs which were separate. And personalized healthcare, I think, will give us identity. We will no longer be a hospital number, and we will no longer be just patient X or patient Y. I'll be called Kaldeep, and Jan will call Jan, and Andre will be Andre. And that's how they'll respond to us. Thank you very much, both. I think I'm so glad of your presence. And the audience, thank you for your time. Please leave this meeting and then come back in the auditorium and join us after the mobility break in this launch of this great study. And I would like to see everybody take part in it and really give us that insight. I think it's part of, I'm laying the first brick for personalized healthcare. First Lego brick. Let's have others. Thank you for your time, and all take care and be safe.